Hello, everybody. This is Dr. Sonia McGowan with Covenant Pediatric Wellness Center. Welcome to the February webinar. Thank you for following me and the date changes. Sometimes life gets in the way and things need to change. So today is our rescheduled date, and I'm so happy that you're here with us. So welcome. Before I get started, just some housekeeping things. You have access to the webinar of this, to the replay of this webinar. So if you are registered, you can go back and watch this as many times as you'd like. We also host the replays on one of my websites, which is thewhymatters.net. So you can go there and have a look. You can also use that as a resource to share with, teachers or doctors or anyone else who you think would benefit from the information. They can go back and watch any or all of the webinars that I've done over these last couple of years. If you have questions at any time, drop them in the Q&A box. I will answer them as I can, kind of as it's natural for me to transition over and answer your questions. So feel free to ask anything that you like, PANDAS related, or, if you have other questions, I'm happy to answer those as well. So let's jump in here and get going. So as I mentioned, I am the owner of the Covenant Pediatric Wellness Center. And so inside that, we have Covenant Chiropractic and Wellness, where we see complex kids. We do work with what we call the spot for tots. So kids who have tethered oral tissues, tongue ties, lip ties, things like that. We also see prenatal chiropractic patients. We see adult chiropractic patients. We do craniosacral therapy, lactation consultation. And then we also have Covenant Pediatrics. And so we have a medical doctor on staff. Dr. Hannah Strong is our pediatrician who does general pediatrics. She also is gaining more experience every day with complex kids. So kids with autism, PANDAS, you name it. We tend to attract the really challenging situations here. And so Dr. Hannah has been fast-tracked on understanding complex kids. All right, so today we're going to talk about a lot of things. PANDAS, also known as autoimmune encephalitis. There are so many acronyms. We're gonna talk through those. We're going to talk about the symptoms. We're going to talk about triggers and causes. We're going to talk about the lab tests that help us figure this out, and then treatments, holistic approaches, and then kind of what you should expect if your child has autoimmune encephalitis in terms of the course of this illness. So again, lots of acronyms. So you will see a long list of them. This is kind of the ones that I see the most often. So PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. PANDAS is the same, but it's associated with strep. We also see the term autoimmune encephalitis, basal ganglia encephalitis, and childhood post-infectious encephalitis. And so when we think about how it all fits together, PANS is at the top of the umbrella, okay?
I didn't get that.
So everything that we're going to talk about technically is PANS. When you sort of drop down and you look, there are infectious triggers and there are metabolic triggers. So if we stay on the infectious trigger side, if that infectious trigger is strep, we call it PANDAS. If it's not strep, if it is a different bacteria, if it's a virus, if it's something that's tick-borne, we call it PANS. And if we jump up and go over to the metabolic triggers, those can be a variety of things. Maybe the trigger was mold exposure. Maybe it's chemicals like glyphosate or other environmental chemicals. Maybe it was triggered by anesthesia. That happens actually with quite a bit of frequency. Then we call it PANS. So really, it's PANS unless it's caused by strep, and then we call it PANDAS. So when we're talking about symptoms, you have to understand that PANS is a neuroinflammatory autoimmune encephalitis. So the nervous system is inflamed, the brain is swelling, and there's autoimmunity, all in one condition. So neuroinflammatory autoimmune encephalitis with multiple triggers. They might be infectious, they might be metabolic, like we just talked about. And so any child who has a new onset of symptoms needs to be screened for PANDAS. The other group of kids who need to be screened is kids with a long list of diagnoses. So we have kids come to us and they have a diagnosis of, tic disorder, ADD, ADHD, pathologic demand avoidance, and ODD, right? That immediately is a red flag to me that a child needs to have a deeper assessment regarding autoimmune encephalitis. Okay, so let's talk about the symptoms. And I've sort of divided the symptoms up into different categories. So we have sensory and physical, and there are more as well. So under the sensory symptoms, here are the things that I frequently see. I see sensory amplification. So everything in the sensory system might be amplified. So maybe their sense of touch or their sense of hearing. A lot of times kids will automatically, will suddenly say they can't stand listening to their sister chew, or they can hear things that no one else hears. A lot of times kids will have a fear of running water and a fear of sort of water in general. And so we'll see that unusual fears are sort of a category of their own, but we'll see things like fear of being outside, fear of water, fear of wind, right? How odd is this? So I never thought anything about a fear of wind until I had a patient tell me my child suddenly is afraid to go outside because of the wind. And a week later, another family who doesn't know each other said, my son seems really afraid of the wind. They don't like to see the flags blowing in the air, for example. And so that stuck in my mind. Multiple kids then, I noticed, were saying that they had a fear of wind. Kids who can't tolerate their clothing, they want to strip their clothing off. And just major sensitivities to anything sensory, taste, smell, sound, etc. So lots of sensory symptoms. Lots of physical symptoms as well. So we will see pain is a really common comorbid condition. So kids will say their joints hurt, their bodies hurt, they have headaches. It is just not normal for a kid to have pain. They just should not. These are kids who will also have a lot of urinary symptoms. So changes in their urine habits. So maybe more volume, more frequency, maybe there's urgency, bedwetting in a child who was previously dry, having accidents, whether it's urine accidents or stool accidents. And I'm seeing more and more kids who will just urinate without warning, even in public. So, they're fine and then they're not fine. They wet everywhere. We also will see a new onset of odd eye movements. So sometimes it looks like stimming, or in just their general eye movements, we will see a pulsation or we'll see, just a difference in the way their eyes move together. Also, very dilated pupils. This is a super common and reliable symptom that I see. Kids whose pupils are huge. They're like dinner plates when they come in, even in a bright room. We also see rapid tooth decay, lots of other physical issues like sleep disturbances, changes in the way a child. Sometimes kids will have what we call selective mutism. So kids just will stop talking. They also will have a new onset of being very busy, kind of hyperactive as well. We see compulsions and obsessions. So just to remind you, an obsession is a thought, a compulsion is an action. And so we see a lot of issues around food. So restricted or ritualized eating, restricted foods, restricted meal times. And so food becomes kind of a big thing. Kids will often lose weight. They might have, 3 foods that they can tolerate eating. Sometimes it's a sensory thing. Very frequently, though, it's a phobia. It's that they are afraid they're going to be poisoned. They're afraid the food is contaminated. They're afraid they might vomit or choke. So some of it is kind of a compulsive thing. Some of it is a sensory thing. Some of it is a phobia thing. We see a lot of apologizing, confessing, and a lot of issues around religion. So religious compulsions, a lot of, I've had kids say, I'm the worst sinner in the family. God hates me because I'm such a terrible person. We also see other rituals. So rituals around lights or rituals around bedtime, that things have to be just a certain way and have to be done in a certain order for that child to feel okay about going to bed or about eating their lunch. We see a lot of hoarding as well. So kids will often hoard different objects, and it's different for every child, but I do see a lot of consistency across paper and cardboard. So kids will, hold on to every worksheet from class, or they'll, cut Amazon boxes apart and save that cardboard. So lots of hoarding. And then just the not wanting to waste anything. So being, super careful about not wasting, not throwing anything away. Those are really common symptoms that we see as well. We also see kind of the more stereotypic compulsions. So things like checking, making sure water's off, making sure cabinet doors are closed. We also see, again, that fear of contamination. So washing their hands a lot, turning the water on and off. We also see something we call scrupulosity. And so this is excessive worry or doubt or being self-critical over moral or religious issues. And so that is a really common obsession that kids have, as well as aggressive or self-injurious rituals, just lots of things having to be just so. In terms of behavioral manifestations, some people might call them psychiatric. I don't love that, but they didn't ask me. So anyway, behavioral or psychiatric. So a lot of times kids will have sort of this increasing fear as bedtime approaches. So instead of like the rest of us, as bedtime approaches, we start winding down, we get kind of sleepy, we get ready for bed. These are kids whose anxiety and fears really just amplify as bedtime gets closer. And so they have just a general sense of anxiety. It also will translate into separation anxiety as well from parents or other caregivers. And so sometimes this creates a lot of drama around bedtime. So kids will say, they're scared to go in their room by themselves. They have to have someone lay down with them. So that anxiety and fear just really amplifies at bedtime. We see kids who are what we call demand avoidant. So, you say, take your plate to the sink, and they're not going to take their plate to the sink, right? So any sort of demand is very difficult for them to tolerate. We also see kids who become very indecisive. Too many choices just paralyze them. So kind of back to what we talked about in the sensory chart, kids who don't like water, they fear water. These are also kids who often have a loss of hygiene. So they're unwilling to shower, they're unwilling to wash their hair. We also see pretty extreme mood shifts, and we see just a lot of needing to be in charge and control interactions, and as well as a loss of social and play skills. And then we see some things that can look, fairly psychiatric, like what, might appear to be hallucinations. They could be auditory, they could be visual. And we see regressions, not only in loss of play or social skills, but we will see behavioral regressions. So kids who will start to baby talk, kids who will revert to watching the cartoons they watched when they were toddlers or playing with toys they played with when they were very small. Again, we've talked about the phobias. And then often we will see vocal and or motor tics. So this is important because you think about a motor or a vocal tic, you sort of think about Tourette syndrome. Well, these tics can be sort of unconventional or not stereotypic. So we very frequently see kids who clear their throat, who have a cough, and a sniffing and snorting is also a really common tic. And then, the more common ones like eye blinking, shoulder shrugging, things like that can be very common as well. All right, so here is an example of loss of skills. So many times we will see academic regression, particularly in handwriting and math. So, kids who were, perfectly able to do math and write, when they are in a flare, they lose those skills. So here on the left, you see, this is from the PANDAS network. So you can see here on the left, pretty nice handwriting for the child's age, but during a flare, they really lose that ability. And then over here on the far right, this is actually a patient of mine, absolutely beautiful penmanship when he is stable. When he is in a flare, he still has nice penmanship, but he has compulsions to write every verb he can think of. And so he just writes over and over on top of words on top of words. So PANDAS / autoimmune encephalitis is a very commonly missed diagnosis. So according to the PANDAS network, more than half of kids with PANS will be misdiagnosed and mistreated for over a year. This is super concerning, right? Because a year is a long time in the life of a child. Part of this problem is that 65% of new strep infections were subclinical, meaning they caused no symptoms outwardly. So no sore throat, no fever, no rash, but were immunologically significant. So the immune system triggered, but there was no symptom that would lead mom and dad to take the child to the doctor. So most times kids are misdiagnosed as having a variety of things. Psychiatric illness, very common. A tic disorder like Tourette's syndrome. Sometimes OCD. Sometimes they'll get a behavioral diagnosis like PDA or ODD. And many times the parents are just accused of poor parenting, and that's why their child behaves this way, which is infuriating. So what causes PANDAS and PANS? So both PANS and PANDAS are clinical diagnoses, meaning that we look at a combination of history, physical exam, and labs. So in 81% of cases, the cause is strep, and we call it PANDAS. So patients with OCD, Tourette syndrome are more likely than controls to have had a prior strep infection in the 3 months before onset. That's a lot. Higher risk among those with multiple strep infections within the last year. So there are many, many times when I have a family bring their child to me and I say, when is the last time your child has had a strep infection? And many times they'll say, oh, they've never had a strep infection ever. And when we do labs for strep antibodies, there they are. They're through the roof. So this is a child who's never had an outward, clinically suggestive strep infection. However, they did have strep, and because they had no symptoms, they were not treated. And so cases with multiple prior strep infections have been found to have more frequent relapses. And again, patients often have a history of a recent strep infection that doesn't present as a sore throat. So you can see why, if kid doesn't have symptoms, why would you even think about PANDAS? So when we talk about PANS, what causes it? So my top ones, second most common. So strep is number 1. Number 2 is Mycoplasma pneumoniae. So this is a bacteria that generally causes pneumonia. And it is the second most common cause of PANS. We also see viruses. So influenza, Epstein-Barr, HHV6, herpes simplex 1 and 2, Coxsackie virus. I would say, in my practice, Mycoplasma, top of the list, so is Epstein-Barr. And it's really interesting because clinically what I see is strep and Epstein-Barr often occur together. More viruses. So cytomegalovirus, parvo, COVID are all possibilities to trigger PANS. We will also see mycotoxins or mold as a trigger, very common actually. We will also see yeast, parasites, and Lyme and co-infections be triggers as well. And so part of the whole PANS picture is that it has what we call a relapsing and remitting course. So kids get better, kids get worse. Kids get better, they get worse. They have what we call flares. And so in terms of flares, what triggers them? Really, it's an exposure to a pathogen. So anything that stresses the immune system. So they go to school and they sit next to their friend who has strep and they don't know it yet, right? Or maybe, dad gets COVID and child is exposed to that. Other things are allergies. Just seasonal allergies are a very common trigger. Just having a cold, sinusitis, a snotty nose. Vaccinations will do the same thing in terms of triggering flares, because remember, it's anything that's going to poke the bear in terms of that immune system response. We also see metabolic stressors for kids. So trauma, anesthesia, stress, so a very high stress situation. Again, with the mold exposure, chemicals like glyphosate, pesticides, herbicides, different things like that from the environment. And then anything dental. So this is a really, really big trigger for flares. So kids often will have increased symptoms when they have a loose tooth, when they have a new tooth that is coming in, if they get braces, if they get a super vigorous cleaning at the dentist, maybe they get a palate expander in anticipation of orthodontia. So really anything dental can cause kids to flare. And so we have to know what makes a child vulnerable. Because if we want a successful long-term intervention, if we want this kid to get better, we have to know what made them weak or vulnerable to this bacteria, to this chemical, to the virus, whatever it is. And so what I see in my practice is kids have lots of nutrient deficiencies. So despite being well fed, these are kids who are not uptaking their nutrients very effectively, and they're not using them to make energy inside the cell. So it's very common for me to see low B vitamins, kids who are very low in their, like, for example, omega-3 fatty acids, vitamin D. It's very common for me to see kids with low cholesterol and kids who have anemia as well. If you're interested in learning more about the low cholesterol link, it is a very important one. Go to thewhymatters.net. And I have done a couple of different webinars on low cholesterol, and I've also written some blogs about it as well. It is very, very important for complex kids, really important for parents to understand. It's also really common for me to see mitochondrial dysfunction. So the ability to take your food and turn it into energy inside the cell is generally very inefficient in complex kids. And so we have to know that and fix that. Otherwise, we're always going to struggle to get this child better. I often see another thing that makes them vulnerable is intestinal dysbiosis. So an overgrowth of yeast or an overgrowth of bacteria, sometimes both, that creates inflammation and permeability in the intestine. And then nervous system dysregulation. So these are kids who are stuck in fight or flight, right? And one of the things that I say a lot is you can't learn algebra when you're running from a bear, right? And so kids who are stuck in fight or flight all the time, they can't learn, they can't heal, they also can't sleep, and they can't poop, right? So we really have to work on stabilizing and regulating that immune system so that it goes effortlessly from fight or flight when it's appropriate to rest and digest when it's appropriate. So in terms of incidence rate, the literature says 1 in 200 kids have PANDAS. That the average age of diagnosis is between 4 and 13. You know what? Based on what I see in my practice, I think it's more than 1 in 200, honestly. I think way more kids have it, and they are just not identified. And so when we're talking about how do we figure this out? So we have to do a thorough history, right? We of the child, but we also have to do a thorough family history because it's really common for kids to have a family history. So parents or grandparents who have a lot of strep exposure, who have autoimmune conditions as well. And then we have to do a thorough physical exam. Um, that I think is missing in a lot of doctors' offices where, if kid has any sort of challenging behavior, doctors just sort of hands off. But you really have to do a thorough physical exam so that you can get a really good look at what's happening to this child physically. We've got to look in that throat, right? We've got to see what's going on with the tonsils. Remember that a strep infection is often found without a sore throat. So we have to do the testing. We can't just say, oh, he's never had strep, or, oh, his tonsils aren't red. It's not an issue. We definitely have to do those labs. And so I do general labs, CBC, CMP, right? I want to rule out, cholesterol. I want to rule out anemia, things like that. And then I do more specific labs that are directed at the pathogen or the toxin that I'm suspicious of based on their history and exam. I also look at inflammatory markers. I look at immune system markers as well. And so it is critical to identify and intervene on the correct pathogen in the correct order. So we can't put the cart before the horse. We can't expect a depleted system to fight a pathogen, right? So we have to look at what made that child vulnerable, fill those gaps, and then start working on what's making them sick. So when we look at traditional treatments, so if you were to take your child to a medical doctor and say, hey, I think they have PANS or PANDAS, autoimmune encephalitis, traditional treatments will be things like antibiotics, if it's a bacterial pathogen, sometimes steroids, sometimes anti-inflammatories. There are some people who say that the tincture of thyme is the appropriate intervention. I think that's nonsense. I am the type of practitioner who doesn't like to wait. So waiting around, especially when you're dealing with autoimmune encephalitis, is not okay. So the tincture of thyme is nonsense. Sometimes we look at things like IVIG or plasmapheresis. So that's basically taking blood products and doing infusions back into the body to help reset the immune response. For some kids, removing tonsils and adenoids is the right thing to do. And if it's not a bacterial pathogen, if it's something else, then generally docs will use medications that are specific to whatever the child has going on. In terms of a holistic intervention, so anything that's anti-inflammatory is going to be very helpful. Sometimes antihistamines, natural antihistamines, are very important too, because this cools off that brain on fire, right? It settles down that immune system overreaction. I use a lot of homeopathy for autoimmune encephalitis. I like it because different forms are available. So we can, we can have liquids, we can have pellets, we can even have suppositories in some cases. And so that makes the dosing easier for the smaller kids, maybe who can't swallow a capsule. I also use a lot of herbs. There are herbs that are extremely effective against PANS, PANDAS, autoimmune encephalitis. And so, again, we have to address what made them vulnerable in the first place. So we have to look at those nutrient deficiencies. We've got to get them making energy inside the cell, heal up their gut, stabilize their immune system, stabilize the nervous system as well. Until we do that, child is not going to get better. So we've addressed what made them vulnerable, right? We've put the right interventions in place. I generally see many kids improve quickly, at least in the short term, right? Remember, this has a relapsing remitting course. So we're going to see progress, and then we're going to see regressions. We're going to see flares. And so if we can get in there quickly, identify the pathogen, work on the foundational health issues, and then give them the right interventions for their particular pathogen or pathogens, we can start seeing lights at the end of the tunnel. Generally, though, it takes some time to cool off that inflammation and see behavioral and health changes. But patients who receive early intervention have much better outcomes than those who don't, right? It just makes sense. But flares are going to happen. And that is really tough for families because they see progress, they see a glimpse of their kid again, and then something happens to trigger them into a flare. And that can be sort of PTSD inducing for a lot of families. And so it's really difficult because we have so many families who have kids with autoimmune encephalitis. And when they try to find a PANDAS or PANS literate medical practitioner, they are usually met with, oh, we don't believe in that. PANDAS, autoimmune encephalitis is not a real thing. Despite the stacks of literature out there about it, they're told it's not a thing. Or doctors will say, well, I've heard of it, but I don't really know what to do about it, so I don't know how to help you. And then there are other practitioners who are willing to help, but they follow a very strict model of diagnostic criteria. For example, one of the diagnostic criteria is that it has to be an acute onset. Well, sometimes parents don't realize what's happening. Many times kids can pretend that they're okay. They can engage in symptoms when they're alone, and they sometimes will actively try to hide symptoms from the parents. The other thing that will happen sometimes is, there's an age range in the diagnostic criteria. And sometimes, because you're so close to the situation, you don't realize when the onset was. When you look back, you can, say, hey, I think the onset really was when he was 7, but now he's 17 and you're outside of that sort of diagnostic reference range, whatever. And so when practitioners follow such a strict model, it sometimes kicks kids out of the potential of a diagnosis because, they're just being too narrow. And so my motto really is any child who has a long list of diagnoses, this should be a red flag to doctors, and this child needs to have a PANDAS workup for sure. So if this kid walks in your office and they have a behavior disorder diagnosis, a tic disorder, ADD, ADHD, PDA, and ODD, right? What are the chances of that? That many diagnoses, right? So they need to definitely be worked up with the right labs to rule out PANDAS, autoimmune encephalitis. So if you want more information, a couple of really good places to go would be the PANDAS Network and the PANDAS Physicians Network. Both are really good, trusted, solid information that I think would help you a lot. So we see a lot of kids with autoimmune encephalitis, lots of kids, and they come to us from all over. And so we have worked to develop referral relationships with other doctors because in a perfect world, a family would have access to a PANS literate medical doctor and a PANS literate alternative provider like us. That's the best of both worlds because you need what both of us provide. Seizure activity is a real possibility for some of our kids with autoimmune encephalitis. So it's very important for us to have a relationship with a neurologist who's literate in this. And so having a team around you is definitely the ideal situation. So we are always taking new patients. I can't imagine we'll ever stop. In fact, we just brought on another new doctor. Her name is Dr. Lacey Mays, and she is working closely with me to gain experience in working with complex kids, including kids with PANS, PANDAS, autoimmune encephalitis. So if any of this sort of struck a chord with you and you're concerned about your child, you feel like maybe this could be part of their picture and you feel like they need a workup, you can definitely call us. You see our number there. If you're interested in an appointment, you can always email my right-hand gal, Brittany. She always does my scheduling for me. So her email address is brittany@covenantwellness.net. So that was the quick and dirty about PANS, PANDAS, autoimmune encephalitis. Do you have any questions before I let you go for today? If you have any questions at all, drop them in the Q&A box and I'll be happy to answer them. While you're thinking about that, sometime today, if you go to my website, covenantwellness.net, you'll find a little freebie specific to PANS, PANDAS, autoimmune encephalitis that might help you sort of sort out if you should look at pursuing a diagnosis or at least a workup. So, question, looks like we have someone who says, yes, I'm happy that you're here. Did you have a more specific question for me? So definitely have a look at thewhymatters.net. That website is going to have a lot of resources for you. So I have, like I mentioned, I have several podcast episodes there. I have many blogs. I usually publish 2 blogs a month. And then also all of my webinar replays. So what do you do about labs in New York State where they are not available? That is a tough one. Generally, yeah, that's a really great question. You would have to ask a New York local about what they do. You would definitely be able to order blood no matter what state you're in, but many of the specialty labs like Genova or Doctor's Data that I really love to use because it gives that information about what made the child vulnerable. Many of those tests are not available in New York State. So it's definitely a downfall. So yeah, but blood work would be available for sure. All right. Last call for questions. Oh, looks like we might have one more. Jill. Hi, Jill. It says, if you've had a lot of different labs done to show things like Lyme and strep diagnosis, do we still need to go through the entire workup? So if you're coming here to be a patient, I will look at what you've already had done and kind of what that timeline was. And if the labs are new enough, then we will take what you have and we won't repeat that, right? We will kind of look at the big picture, decide what needs to be done, take into account what you've already had done. And if we can avoid repeating it, we definitely will avoid that. Yeah. Okay. Any other questions? So this is a really big topic. Like I could literally, talk for hours about this. Definitely do your research, talk to your pediatrician, and seek out someone, a practitioner who is experienced and literate with this topic, and not just the right here, right? You need a doctor who can see the big picture, understand your child's health from head to toe, so that understanding what made them vulnerable to this in the first place is absolutely critical. You can't, put in a heavy duty PANDAS intervention on a body that's depleted. It's just not, it's not going to work. So really trying to find a practitioner who understands, that can be challenging. All right. Do I come across patients who, despite years of attempts to bring down IgG and IgM of mycoplasma, that won't budge, despite rounds of antibiotics, homeopathy, herbals? So I do see that. Sometimes it's mycoplasma, sometimes it's other things. So a lot of times what I see is we'll have 2 pathogens that are sort of coexisting. And excuse me, what I see is one of those pathogens is almost like the gatekeeper, and we have to address it first before the other one is going to respond. I see this really commonly with strep and Epstein-Barr. They go together a lot. They co-occur. And generally, if we work on Epstein-Barr without working on strep, nothing happens. But when we work on strep, then the Epstein-Barr tends to start responding. I've seen it with mycoplasma. I've seen it with other viruses as well. And so what I would say is make sure that your testing has been comprehensive and that you know every pathogen possible, so that then your doctor can use their clinical judgment to decide which pathogen is the priority. And if it didn't work going in that order, trying a different pathogen, right? Because sometimes that will unlock the one that isn't responding. All right. Anything else that I can answer for you before I let you go? Strep and EBV are negative. Tons of other pathogens are negative. Interesting. Yeah, it's tough. You really kind of need a crystal ball or an owner's manual, right, to figure this out. Sometimes, so maybe in this case, if everything else in terms of pathogens are negative, I might be looking for something else, like mold exposure, like, oh gosh, a chemical exposure of some sort, like glyphosate, or something else that might show up on a tox report. The other thing might be detox pathways. So many of our kids are not good at detoxifying, and sometimes that's what hangs them up. So occasionally what I'll see is if we kind of press pause on addressing pathogens and we work only on detox and drainage, sometimes that opens the door and lets you start making progress with the mycoplasma or whatever it might be that you're stuck on. Yeah. All right, guys. Anything else that I can answer for you? Thank you so much for hanging in with me. This was a long one, so almost 45 minutes. I hope it was helpful for you. If you have any questions at all, you see my email address here, drsonia@covenantwellness.net. You're welcome to email me anytime. If you are interested in an appointment, it's Brittany@covenantwellness.net. Don't forget to check the website. Sometime today, there's going to be a freebie that we're putting up for all the folks who attended today. And our next webinar, I do one every month. And so this was our February one. And so I think the March one should be March 1st. I don't know. Oh, you know what? I'm looking at the wrong year. It's actually March 7th. So, you know what? I'm rethinking it. It's March 3rd. Sorry about that. I need to have my dates in front of me. So, March 3rd is our next webinar. Oh, and I have another question. Do you do telehealth with New York State residents? If you actually would email me, I'll be able to answer that question for you. So drsonia@covenantwellness.net. All right, guys. Thank you so much. We'll see you in March for our next webinar. And I hope you have a great day and a fantastic month. Take care.